and this video is on splicing of pre-mRNA. You and your favorite study partner are reviewing MSK, skin, and connective tissue pathology. You're going over SLE. You got the signs and symptoms and classic presentation down. Now, what are some antibodies that can be elevated in this disease? Everyone knows ANA levels are typically elevated, but can you think of any other antibodies? We're going to be talking about splicing of pre-mRNA today. In the next few slides, you should be able to 1. Describe the process of pre-mRNA splicing, and 2. Describe the associated disease related to snRNP. Alright, so what is pre-mRNA splicing? It is a process of pre-mRNA or precursor mRNA transform into mature mRNA. It is how introns are removed from pre-mRNA. This diagram here is straight from your book. In this diagram, the intron is a DNA between exon 1 and exon 2 and includes a few key nucleotides. First, the transcript combines with the small nuclear ribonucleoprotein, sometimes called SNRP or snRNP, to form a structure called the spliceosome. The snRNPs recognize specific sequences in the transcript and cause the DNA at the beginning of the intron, or the 5' end, to detach from the exon as this phosphate binds to a specific adenine within the intron, creating a loop called the lariat. Exon 1 is then joined to exon 2 after splicing at the 3' end, and the lariat is no longer attached to anything, so it floats away and is degraded. This lariat contains the intron, so after doing this to all of the introns, you end up with only exons. It is not very pertinent to know all the minute details of this process. Understanding the general concept as a whole is much more beneficial, and understanding the clinical associations is even more key because that is how board questions will be framed. Do you know what happens if the snRNP is defected or altered? One such consequence is spinal muscular atrophy, which is a group of neuromuscular disorders that result in the loss of motor neurons and progressive muscle wasting. It is due to a genetic mutation in the SMN protein, or survival of motor neuron protein. This mutation causes defective snRNP assembly, and therefore splicing of pre-mRNA is affected. Low SMN protein, as the name may imply, results in slow death of motor neuron cells in the anterior horn of the spinal cord. The severity of the disease varies and includes symmetrical weakness, hypotonia or floppy baby syndrome, developmental delay, and loss of respiratory muscle strength, which can cause a bell-shaped torso. There is no cure, and treatment comes down to management. However, individuals affected with SMA tend to deteriorate over time. Survival can be increased in severe SMA patients with aggressive and proactive respiratory nutritional support. Okay, so back to what we were talking about in the beginning of this video. SLE is a high-yield autoimmune disease that has an array of symptoms. It is known to present with a distinct macular rash, as well as joint pain and fever, and is most commonly seen in African American females of reproductive age. As mentioned earlier, antibodies to ANA are very common in SLE and very sensitive. But additionally, antibodies directed against snRNPs or anti-Smith antibodies, are highly specific for SLE. Anti-double-stranded DNA antibodies are also specific for SLE. And anti-histone antibodies like ANA are very sensitive for drug-induced lupus. It is also important to recognize that although anti-Smith antibodies are specific, they are not very prognostic. Okay, time for a quick flash quiz. What is the cause of spinal muscular atrophy? Recall that spinal muscular atrophy is a group of neuromuscular disorders due to a genetic mutation in the SMN protein. This mutation causes defective snRNP assembly and therefore defective splicing of pre-mRNA, leading to degeneration of the anterior horns of the spinal cord. Alright, so the bottom line is, pre-mRNA splicing is a process of transforming pre-mRNA into mature mRNA. Alterations in small nuclear ribonucleoproteins, or snRNPs, can lead to spinal muscular atrophy, which causes weakness, hypotonia, developmental delay, and loss of respiratory muscle function. And lastly, antibodies directed against snRNP are specific to SLE. That's all for splicing of pre-mRNA. Thanks for watching. If you enjoyed the video, don't forget to give us a thumbs up.